So my name's Thomas Malchow. I went to university here. I graduated in 1999 from the kinesiology program. After graduating, I went on to become a human movement specialist, a corrective exercise specialist, and a golf specialist. So I specialize in posture and improving the efficiency of human movement. I deal primarily with athletes, but when you're talking about improving performance, it doesn't matter if we're dealing with it on an athletic side of thing or improving the performance so that your body doesn't hurt when you do your job. It's literally what I'm showing you here is the same stuff that I do with Olympic and professional athletes. Okay, so with that, what types of injuries are we dealing with? Do you have like neck pain? Everybody have neck pain? Yeah. You know what? The neck pain was not something that I really appreciated how bothersome it was and how much it would affect your life until I got in front of a computer about 2 years ago and spent a lot of time working on a computer, and it's debilitating. So I can really appreciate that. I'll show you how to deal with that. Any headaches? Headaches, yeah, usually goes with the neck pain. Shoulder pain? Anything? Yeah, shoulder pain. Forearms? Any low back pain? Yeah. Anything else? We'll cover everything, and that's another thing too. So I'll be showing you how to do everything. If anybody wants to try it, come up, volunteer. I'm not going to force anybody to come up. But the more questions, the better. This isn't going to be like a boring lecture where I'm standing up here giving a bunch of theory. We're here to deal with your issues and to make you guys feel better. Okay? So we'll do 3 main routines. The first routine will deal with the upper body stuff, so with the headaches, the neck pain, shoulder pain. Pain is usually a result of postural dysfunction. And so the posture associated with neck, headaches, shoulder pain is this forward head posture. And when your head moves away from your line of gravity, so your line of gravity is an imaginary line from your center of gravity to the ground. And as your head moves away from that line of gravity, a few different things happen. One, it forces these muscles back here to hold your head up. And your head weighs like 10 pounds, right? So they get tired and they get sore. Another thing that happens is it shortens these muscles. So even though your head's going out and it seems like these muscles are getting longer, they're actually getting shorter. And when muscles become short, they become overactive and they become very tense. Okay? So when it comes to fixing the posture, the first thing we do is we go after those short, intense muscles and we inhibit them. So we can inhibit muscles by pressing on them. So that's why massage feels good. And what we're doing, I'll show you a few different ways to do it with your neck and where the trigger points are. So your body recognizes dysfunction as an injury. So when you have a postural dysfunction, your body thinks you're injured. It creates an injury cycle, and that's how you become injured, even though it was just from a bad posture, right? And so part of that injury cycle is the formation of these trigger points. And these are adhesions. And so if we apply pressure to those adhesions, it stimulates a reflex inside the muscle that will get the muscle to relax. Okay, so we're targeting those adhesions. This is one of the best things I've found to do that. You can do it yourself. What you do is you pick, doesn't matter which side you use, but there's 3 or 4 different trigger points. There's going to be one right here at the top of your shoulder blade. There's going to be one just below that, and then there'll be 2 out to the side. And it doesn't matter, but anything, you're just going to survey around, and any spot that you find that hurts, you're going to push on it. Okay, so it doesn't have to be a specific spot. You're just looking for the most painful spot. You guys want to try this? Are you ready? Go ahead. Yeah, pass it around. So you just put it over. You can pick an end. Yeah. Here, I'll show you.
I am taking this seriously.
Yeah. Thanks for showing up.
Yeah, thanks for coming. It's over there.
So you're actually let's go out in the front here.
Okay.
Yeah.
Sure. All right. Okay.
You got it. You got this.
I'll be colorful. If the pants fall down, it's not
Will not look.
avert your eyes.
Okay, so we'll get you a face out that way.
Okay. All right.
So his shoulder blade, actually this we can actually assess this here. So the shoulder blade's right here, one on either side, right? They should be sitting so that the bottom corner is further away from the spine than the top corner. We should have about a 3 to 10 degree angle there, okay? So I can actually feel, and he does not, right? So that means that his shoulder blade has moved this way, and that's called downward rotation. The reason it's downwardly rotated is because there's a muscle from the top corner to the base of his skull that's become too short. And it pulls it this way, okay?
Right.
And so the first thing is to find that trigger point, which is usually right in here somewhere.
Yeah.
We feel that?
Yeah.
And then we would push on it for 30 seconds to 2 minutes, either using the back buddy, using a ball against the wall, using your own thumb or your spouse or whatever, anything to push on it. It doesn't have to be a really like painful push, like you don't have to use a lot of force, but enough so that you feel it, okay? So after applying pressure there, we would then look for probably 2 or 3 other trigger points. The rhomboids are here, so they become short also. We're pushing on all the short muscles. So there'll be a trigger point usually in this area here.
Oh yeah.
Right? And same thing, we'd push that for 30 seconds to 2 minutes. Now, up here it gets interesting. And I'll try not to make this too boring. Generally speaking, when muscles become short, they become overactive. So muscles are usually either short and overactive or long and underactive. The short and overactive muscle will pull the opposing muscle long and making it underactive. Like if my bicep shortens and becomes more active, my tricep lengthens and becomes underactive, right? That's how we move. But that can also cause issues in our posture and how we just walk around or statically sit. So these two guys have become short and overactive. There's a trigger point up here.
Oh yeah, that's the one.
This is your upper trapezius, but this is kind of the unique muscle. This guy's been pulled long. You see how that would work mechanically? So if it attaches here, and these muscles have pulled the shoulder blade this way, now this attachment is further away from the spine, and so it's been pulled long. So it's actually a weird muscle that gets long and overactive. But in any regard, the trigger points are going to be the levator scapulae here, the rhomboids, upper traps, and then sometimes there'll be another one in here, but not everybody gets it. But this is your supraspinatus. This is part of your rotator cuff. Do you feel anything there?
Not really, but I
Not too
know
much.
what you're trying to do.
Yeah. Yeah, sometimes the overactivity usually starts with the levator scapulae, and then it will work all the way up into your neck, and then you'll get these suboccipitals get sore up here. It's hard to push on these guys. And then what happens is you get 2 types of headaches. One, you'll get the headache that's right here, or you'll get the headache behind your eyes, right? The headache that's right here is from these muscles being too tight. So if you have a headache and it's here, get after these guys, okay? If you have a headache and it's behind your eyes, it's because these muscles here, your suboccipitals, are tight. So if it's behind your eyes, you get after these guys. These guys, you could use tennis balls. You could use your thumb. You could lay on the ground and get a ball there. Yeah, and if you feel around, you'll feel some tension there. When they become short, they drive your head forward. And that's when you get that headache behind your eyes. Okay? So the first thing we always do, we have I guess we'll call it an algorithm that we follow. We always inhibit the overactive muscles first. Okay, so that would be these trigger points in here. Also a trigger point in your chest, your pec minor, goes from the top in a 5 push. I'll show you. Get you a big here. So it goes from your shoulder blade, wraps around here, and then goes to the first 3 to 5 ribs, and there'll be a trigger point usually.
Yeah. Yeah, I know that one too.
Right, so this one's a little harder to get at.
Yeah.
you can push on it yourself. Like I can find mine quite easily, and so just doing that will initiate. Yeah, you have a question?
Yeah, right under the collarbone.
So it will go from your acromion here, or coracoid process, from here to your ribs. Yeah. So anywhere in here, you just find that spot. I'll show you how to do that. I'll do this so you don't have to get down on the ground. I use this ball. But if I lay on the ground and I get the ball right here, so that I'm like this, and I just lay there for 30 seconds to 2 minutes, that will release that muscle.
And how hard, I mean, what's the ball texture like? Is it supposed to be dense?
Yeah, so that works really
well.
well.
Oh, yeah. That's not like a rubber ball at all. When you said tennis ball, I was thinking it would have some
It's not really hard enough. You're not going to feel a lot of satisfaction.
Unless it's brand new.
Possibly.
Sometimes it's brand new.
And you could put it against the wall as well
Mm-hmm.
and get after it that way.
Right.
Or a softball, a baseball.
That's something that doesn't give.
Something that doesn't give too much, yeah. Those are expensive, but quite honestly, it's just a baseball or a softball.
And does it make any difference? I just saw an advertisement for something that has little like nibs on it. Is that better? Does it matter?
It's more aggressive, so it can be, but you have to understand that it might be a bit aggressive for you in the beginning.
Too much,
but ultimately, it is good. Like if you take a look at my foam roller,
yes,
it's got a lot of little things that helps you get after different spots. But if you haven't used one of these before, and this is the first one you're using, it's gonna be like, I'm not doing that again. Right? You can't.
You don't want to hurt.
Yeah, if it hurts so much that you're tensing up, well then that's probably just reinforcing dysfunction rather than relaxing, right?
Right.
What does pushing on the muscle do?
It initiates a reflex. So it's called autogenic inhibition. So when you push on the muscle spindles, like within the fibers, they all start to relax. And it's probably due to circulation. So the muscle thinks it's getting squished and there's not enough blood supply, so it'll start to loosen up. And that's what the theory behind it is. It works quite well. And this stuff works really quickly. When I say I'm working with an athlete and they have to perform, I do an assessment on them and they're not moving properly, do a couple little pushes, a couple stretches, and it changes the length of the muscle immediately. These aren't things that take weeks or months to really make too much difference.
But is there cumulative benefit?
Oh, yeah.
It gets better over time.
Yeah, it gets better over time. Your tissues all have a capacity. And so by capacity, I mean how much that tissue can endure before it becomes injured, right? And so we can think of capacity as being like a commodity, kind of like money. So everything you do is either putting capacity into your tissues or taking it out. So if you are doing these things all the time, you're always putting money into your bank account, you can go do a lot of other stuff before you run out of capacity and start to feel pain, right? Yeah, you can
good.
Yeah,
Thank you.
So that would be for anything to do with upper body stuff. I'll show you another one too here. This is for the latissimus dorsi, and the posterior shoulder gets quite tender in here as well. And so a good way to get that is to get down on the ground here and just get that into your armpit. And just laying here like this in a comfortable position, you can put your head on your fist like this, and you just sink into that. And by the way, some of these, when you first do them, will be extremely painful, and within a week or two, you won't even feel anything, right? So you would just sit here like this, and that would help relax that. If you have any pain, 2 to 5 days a week. These routines take 10 to 20 minutes.
Yeah, you're saying 30 seconds to 2 minutes for each particular.
And so the upper body would have 4 or 5 different spots you would hit. The pelvis, lower back would have 4 or 5, and if you had lower extremity stuff, same thing, 4 or 5. The forearm stuff is really neat. I'll show you. So forearm, same thing. But I'll show you that when we get to it. So then after you inhibit the muscles, So you inhibit all of the overactive muscles and then you stretch all of the short muscles. Usually those are the same muscles, but not always, right? Because as we just saw, the upper trapezius, you wouldn't want to stretch, even though it feels good to stretch it. The reason that muscle feels so tight is because it's tense, it's overactive. And so that's a neurological tightness, not a mechanical tightness. And so you want to lengthen a muscle that's already too long. Okay. And actually, before we get to the lengthening, after inhibiting the muscles, the next thing you do is actually you mobilize. And so what we would mobilize with the upper body is our thoracic spine. So I'll show you how to do that. So you get this foam roller just below your shoulder blades to start. You get your hands up like this and you just fold over. And you might hear some popping. You might go numb and no. You won't go numb. You would never do this below your ribs, right? So your ribs are providing some extra structure to your spine so it can deal with the shear force. Your low back doesn't have any ribs, and so I wouldn't do this to your low back. But you would find, say, 3 different spots, and you would just do these flexion extension cycles 3 to 5 times, and you move up an inch and do the same thing. And what this is doing is it's mobilizing the facet joints. So one of the issues that happens with, we call it upper body dysfunction, which causes a lot of the pain from our chest up. Upper body dysfunction pulls our thoracic spine into flexion, okay? And that does a few different things. One of the things it does is it changes the way the facet joints line up. So the facet joints are on the side of your vertebrae, and they're the joints of your spine, right? And they're supposed to slide. They're gliding joints. They're supposed to just glide and slide past each other. But if your spine is put into flexion, then those facet joints don't line up properly. It causes extra wear and tear, makes it hurt, and also reduces your mobility. And if your body can't get mobility from your thoracic spine, it will take it from your neck and your low back. So your neck will push out even further. Your low back becomes more unstable. You have neck pain, low back pain. One of the most, or probably if you could only do one thing to improve your general health with upper body stuff, would just be that mobilization technique. So I'll show you it again. So just find, say, right on your shoulder blades, hands up like this, and just lean back slowly. Just find 2 or 3 different spots. This is also another good way to release or apply pressure to your rhomboids, which have become short and overactive as well. Okay. Another way to mobilize your thoracic spine, and this is good for your low back as well, would be, they're called open books. So I have my bottom leg straight, top leg up here like this, 90-90, hand here, but I'm not pushing down. I'm just holding on. You don't want to, the reason I have this here so that I don't get too much rotation into my lumbar spine. So I'm supporting my lumbar spine here, and I'm just rolling back. And as I roll back, I mobilize my SI joints on my low back. I mobilize my thoracic spine. I stretch my chest. I stretch my piriformis in my hip. This is a really productive movement, but you wouldn't do it until you've inhibited those tight muscles, okay? So we've inhibited all the overactive muscles up here. We've mobilized our thoracic spine two different ways, and then we need to stretch, okay? So 2 stretches that can really make a huge impact on just how you feel. One is for, usually these foam rollers are longer, this one's short, that's why I have the U1 look. So just here like this. And then you can start here like this, let your elbows drop down. If you can do that, right here you're just mobilizing your thoracic spine essentially and just opening up your chest a bit. You progress to here behind your head. Now you're starting to get your chest into it a little bit, as well as one of your rotator cuff muscles, your subscapularis. And if this is okay, you can increase the lever arm and straighten your arm out. But because you've increased the lever arm here, there's a lot more force pulling on these muscles. So if you feel that that's too intense, just bring it back here. And the stretches you hold for 30 seconds to 2 minutes as well. Okay? That's actually my favorite stretch.
And I have a lot of yoga equipment, so a bolster and stuff. Is it hard enough, do you think? Like it won't compress really?
Yeah, probably.
Yeah,
Yeah.
okay.
Yeah. I even see people just roll up a towel.
Oh, okay.
Right? Just anything to sort of just
Right.
put along your spine and just
Yeah.
add a little bit of depth.
Yeah.
Thanks. And the smooth foam roller.
The smooth foam roller is probably best for most people.
Okay.
Yeah. So then we stretched our chest. It's short. We also stretch, so it's pec major, pec minor, subscapularis as part of the rotator cuff that pulls us forward. I'm going to show you a stretch for your neck, for the levator scapulae, but you have to be really careful when stretching your neck. You don't need very much force to lengthen your neck muscles, right? If you think about your calves take a lot of force to lengthen. Your hips, around your hips, takes a lot of force. Shoulders, a little less force. Your neck is way on the other end of the spectrum, just a tiny amount of force. And I found with most people who have neck pain, especially if it's from like whiplash, stretching the neck is not productive. But I'll show you how to do it because for some people it is. Okay, so if we want to stretch this side here, I'm going to put my hand behind my back to anchor the shoulder down. I'm going to tilt this ear towards that shoulder, and I'm going to look down at this pocket. And I'll feel that right here. Okay, I can apply a tiny bit of overpressure, but I'm not pulling. If you pull, you're just going to increase inflammation. Okay, so be careful with that one.
So I have a lot of immobility in my neck. That would help with that, I would think.
Yeah, we're going to get to how to get more mobility into your neck after I show you this next stretch, because this is all part of lining up those facet joints, even up here. Okay, so then one of my other favorite stretches, this stretches the lats, because although your lats are in your back, they attach in your bicipital groove here in the front. So when they become tight, so they go from my pelvis all the way up under my arm and attach here. So when they become tight, they pull my pelvis this way and they pull my shoulders this way, right? So it's weird. You would think that it would pull you this way, but they pull you this way. So to stretch them, and this also stretches your rhomboids and your erector spinae. As I get down in the child's pose, you can use just the ground here like this. Okay, it's probably a yoga stretch. They do that in yoga. It's a great stretch. So you get the pelvis side, you get the shoulder side. The lats are a big muscle. That gets both ends. Okay, any questions about any of that stuff? So we've inhibited, we've mobilized, we've lengthened. So we just do those two stretches. You can stretch your neck. Then we have to activate. So we activate the muscles that have become too long and are underactive. So those muscles are our deep neck flexors. So as these muscles here push our head out that way, these muscles here become long. They become underactive. And that reduces our mobility, just like what you're having right now, right? So we have to get that chin back, okay? There's a few different ways we can do this. Some are easier than others. This is a tough area to get at because of the complicated nature of trying to activate them. When muscles become inhibited, the synergists, these are the other muscles that are supposed to help the inhibited muscles, the synergists start to take over. And you can end up with this situation that's called synergistic dominance. Okay, it happens with our hamstrings a lot. The synergists to our deep neck flexors are the sternocleidomastoids on the side here and the scalenes. And so when we try to activate our deep neck flexors, quite often we just ramp up the synergists and they're already quite sore. So you have to be really careful. I think one of the best ways is just trying to just stand against the wall and just trying to get your head against the wall and your chin down, you're trying to make a double chin. And that's hard. It's really difficult to do, right? And so a lot of my exercises that are done for the upper body start out either on the floor in that position or against the wall. That's not an easy position to get into, right? So that's what I'd work on. If you're in your chair, you can work on just sitting up and trying to get your chin back without, doing that, of course, but just trying to get back. And you can try to feel these guys, make sure these muscles aren't just taking over, because they will. We don't want to get these guys active. They're supposed to be helping, not dominating.
So I noticed when you were standing against the wall, you had your feet out from the wall, you weren't right against it.
My bum.
Okay, so that's not sure that's where you're.
Otherwise, I would go like this. Yeah. So yeah, we can go. I know people will often tell their clients or whatever to go against the wall, but you have glutes there in the way, so give yourself a little bit of room.
Perfect.
Okay, so that would be the deep neck flexors. I would just either try to get 10-second holds, say 3 to 5 10-second holds where you're just trying to get back there, because most people can't get back there, right? And so if you can't, you just work on that, count to 10, take a 5-second rest, do that again 3 times. If you can get back there, then what you would do is you would actually do a plank where you would hold yourself out, okay? And you would hold yourself out for 30 seconds, 45 seconds, up to a minute. You could also, if I'm working with somebody one-on-one, I get them to do these. These are a little more difficult because of the fact that these synergists will want to kick in, okay? But what you could do, if you have a band, you can grab the band, hold it out, go against the mirror preferably so you can see if you're going to one side or the other, and you're just doing a chin tuck. Okay? These, because like I said, I've dealt with a lot of neck pain for my clients. Not until recently did I have to do it for myself. And the exercise that makes this go away is this one. This helps right away. But I'm doing it correctly, right? If you get these muscles jacked up, you could just reinforce that dysfunction. So work on trying to get your head against the wall, okay? Once you can get your head against the wall, there's a little more than I was going to show you, but these are really good exercises. So the next thing you'd want to work on is, because your shoulders have rounded forward. So we got our heads moved forward. We've inhibited and lengthened these guys. We've mobilized the spine. We've activated these guys. So we're starting to get our head back. That's going to take a while because of the thoracic spine issue. So you won't notice a huge difference with that right away, but it will happen. And it will happen, it's a steep curve. So like not much will happen with that, and all of a sudden you can get your head against the wall, okay? Now we want to work on the external rotators of your rotator cuff. And by this point, you can get your head against the wall, okay? Now, again, I wasn't going to show you this, but you guys are pretty good. So when you do an exercise, anytime you do an activation exercise for a muscle that's been inhibited, you're going to have overactive synergies that have to be inhibited, okay? So these guys were overactive for the deep neck flexors. When it comes to our rotator cuff, the external rotators of rotator cuff, the overactive synergists are the supraspinatus, which is part of a rotator cuff, and the posterior shoulder, okay? So if I want to inhibit this is a good example. You guys get the cramp in your calf at night ever? Yeah. And how do you inhibit it? You stretch it, right? To inhibit a muscle, you lengthen it. And so if I want to inhibit my posterior shoulder does extension. I can put my shoulder into flexion, and I've inhibited my posterior shoulder. Doesn't mean it's not active. It means it's just been ramped down, okay? My supraspinatus does some abduction. I can inhibit it by squeezing in. So I can really isolate the external rotators of my rotator cuff by getting my shoulders forward, or getting my elbows forward and squeezing my rib cage, and then doing this. You've probably seen people do this exercise and they do it like this. They're just ramping up their posterior shoulder, which is already overactive, and their rhomboids, right? So get against the wall, squeeze your ribs, get your head up against the wall, elbows forward, and then out, hold for 2, and then back for 4. This is one of these exercises that people usually aren't interested in doing, but it makes a big, big difference on your posture and your health.
So if somebody already has pain in their rotator cuff, can they go ahead with this anyway?
I would, usually the pain is a result of the supraspinatus getting pinched through the acromial space, and so I would hold off until the posture's a little better, because that acromial space gets narrowed when your shoulders are downly rotated. So as the posture becomes better, and you'll see that you're moving in better posture.
Yeah.
Otherwise, you could, the supraspinatus goes through the subacromial space, but infraspinatus is right there with it, and that's one of the external rotators, so you could potentially get some wear and tear on that. So I'd wait till the posture is a little bit better. Okay. So after doing that, so we got the deep neck flexors, we got the rotator cuff. Then we need to get after, have you guys heard of serratus anterior or the lower trapezius muscles? How about winging of the shoulder blades? So as your shoulders move this way and your shoulder blades go into downward rotation, your lower trapezius and your serratus anterior become too long, they become inhibited, and then you lose the stability of your shoulder blade. And if you don't have a stable shoulder blade, you don't have accurate elbow movement, which means you get tendonitis pretty soon, right? So you need to have accurate elbow movement, which means you have to have a stable shoulder blade. Best way to get after those two muscles is, this will be really tough. I'll show you the version on the floor as well. Just get against the wall, up, and then just trying to press up without letting your low back shoot out that way, right?
Yeah.
So on the floor, it would look like this. I don't know about you, but most people can't get here yet. So it takes some stretching to get here, and then you're just pressing up, keeping your belly button drawn in. And as you're pressing up, you're keeping the elbows against the floor, and you're forcing your lower trapezius and your serratus anterior to activate, because you're upwardly rotating your shoulder blades, which means the downward rotator is getting stretched. So the levator scapulae, the rhomboids that are overactive, are getting stretched, and you're starting to integrate the upper trap work that is overactive, but it's too long. So those, I call them wall angels, but we call them floor angels, are a really good exercise to incorporate all of that. Okay. So again, you don't have to try to remember this. You send me an email afterwards, I'll send you the routine, you just follow. Take you 10 minutes, you do it 3 times a week, and it'll make you feel a lot better. Okay? All right, let's do the forearm stuff. So, forearm stuff is really cool. The way I look at pain is it's always because of bad posture or sustained posture, right? So the posture associated with forearm pain, whether it's wrist, forearm, or elbow, is excessive pronation, ulnar deviation, and extension. So it's usually typing or pinching and doing that type of stuff. And so same thing, we're going to inhibit the overactive muscles first. We're going to use a foam roller, which is this little tiny guy. And the overactive muscles are in the back of your arm, by the way. You get a ton of trigger points here. So these muscles have become short and overactive, and these muscles are long and underactive. So we're going to inhibit and stretch these muscles and then activate these muscles, okay? So you just get up against the wall. Again, survey around just like with the ball, looking for the most tender spot, and you just apply pressure into the ball. Anybody want to try this? No?
Can I just do it here?
Yeah, you could. Yeah. The one issue with doing it there is you're going to end up getting a weird thing. I would get it against the wall there.
And where do you get?
Amazon. So this is a Amazon TheraBand Flex Bar. So I would put it right there. You usually have to survey around a little bit and just use your body weight right in there.
Oh,
Yeah.
not roll.
No, you just find the most tender spot. Find it? Yeah.
It's working.
Yeah. Yeah. Yeah, so there's a ton of trigger points usually back here. So after doing that for 30 seconds to 2 minutes, you have these muscles relaxed, you've initiated that reflex. They're now going to be easier to lengthen. The one issue with lengthening them is if you have carpal tunnel issues, you could be compressing it. So usually I don't prescribe a stretch, but if you were to stretch, you would just be and just trying to curl your fingers underneath, and that would lengthen those muscles. Keep in mind if you have carpal tunnel issues or you have any numbness, don't do that. Okay. Now you got to activate the flexors. Okay. So this is where things get a little more interesting. People often do this one wrong. So if I'm going to use if I'm trying to get my right hand or my right forearm, I put it on the bottom, okay? I grab the flex bar. This hand's going to apply resistance so that when I try to twist it, it doesn't move. So I start an excessive extension here, okay? Keeping this part of my wrist down. And what I'm doing is I'm just curling, hold for 4 seconds, and then back. The reason I put this hand on the bottom is if it goes on the top, I'm going to have a tendency to do that, which is part of the dysfunction we're trying to get you out of, right? So if you try to keep this xiphoid process of your wrist against the table as you do that, and it's hard. It's hard to do that. It's hard to get, you see mine starts to even come off, right? And that will really activate these muscles again. As you activate a muscle on one side of the joint, the other muscle on the other side has to relax, otherwise you can't move, right? So the activation helps these guys relax. Okay, wanna try that?
Yes.
Yeah, so keep that.
Yeah. So you're locking this for a better job.
Yep.
Yeah.
Put that down. Grab that, start into extension, you're not gonna be able to move much. Yeah. And hold down for 4 seconds. And of course, you would need a stiffer one. This is a really light one, right? Like you use.
And then you're doing this back and forth, but you're holding this.
Holding this for 4, you can feel that in there,
Oh, yeah.
right? And so as this relaxes, as that fires,
Right.
right? And then you go back slowly. And if you had a stiffer one, what you can do is just hold it for 2 and then go back for 4.
Right. Yeah, this one's a little
Yeah, it's not going to be stiff enough for
stiff
you.
enough for me.
How would you know what's the,
If you have serious pain, the yellow is good. So you met Christine, right? Yeah. So Christine's tiny, she's really little.
Yeah.
She uses the yellow one. Her pain was quite severe because you don't want to, this isn't weightlifting, right? You're not trying to get bigger muscles, you're just trying to direct neural drive around your body. So you just need enough so that there's a stimulus to cause a change, but it's not a workout.
How does blue one compare to the yellow?
Blue one's pretty stiff. I usually get the green. Like for you, I'd probably say the green's probably good. You would be able to do the blue, but it might force you to compensate a little bit. And we're trying to focus on perfect recruitment pattern. Yeah,
Perfect form.
exactly.
so it's like in really a sequence.
Exactly. Always inhibit and then mobilize when appropriate, lengthen when appropriate, and then activate. Anyone else want to try?
Come on.
Okay, so remember the postural deviation was too much pronation,
Yeah.
extension, and ulnar deviation. So we also wanted to get you out of this ulnar deviation, which means we gotta activate these muscles, okay? Now, the way we do that, you're gonna grab it like this, you're going to slam that against your wrist, you can hold that, or you can put it against the table, doesn't matter, I prefer to hold it, and you're going to just bring your wrist up to neutral. But here's the deal. One muscle that does that movement is a flexor and is underactive. Two of the muscles, so three muscles do that, two of them are extensors and they're already overactive, right? So we don't want to activate the two extensors. So what could we do to make sure that we don't activate the extensors as we do this, right? If they're extensors, if we put our wrist into a little bit of flexion first and then do it, then we've just inhibited the extensors, right?
It's a slight.
Just a slight, yeah. And again, this doesn't mean that the extensors are off. It means that they've just been toned down because
So instead of straight.
just right there. Yeah, and then up. Yeah, but careful. See how these guys just dominate, right?
Yes, they
So you
do.
have to force it.
Oh,
And just
right.
teaching your body the appropriate recruitment pattern as its default pattern that it's just fallen into. And you're just retraining your nervous system
So
where you want to direct that neural drive.
if you're out like that, then you're really working out over here. But you
That's right.
You read about like that.
Yeah, and there's not much movement there, but that's exactly what you want to do. No, because you're not bending the elbow. But if you were to bend the elbow, then I would, yeah. Do you want to try that?
So your like body start to learn to like hold itself,
Exactly.
even when you're like walking,
Exactly.
or like swimming.
Yeah.
Okay.
So, and this is the stuff that I would do with an athlete to get them ready to perform, right? Because this doesn't mean your body.
I'm not trying to keep this down.
No, you can just hold that with the other hand, but yeah, you can do it like that as well. Yeah. And again, you would hold at the top for 4 seconds. So, like, remember your mom used to say, if you make a face, it will stay that way? She was right. That's actually what happens. Your nervous system starts to just reinforce certain things, but you're not stuck that way forever. You just have to retrain where you want the neural drive to go. Right? Anything else you want to add? No? Okay.
I don't want to break it.
Oh, no, that's fine. I'll leave it with you. You can practice. Okay, now the pelvis stuff is really interesting. As you can imagine, probably the most important stuff if we're talking about just general health and well-being, right? And so the dysfunction that generally happens around the pelvis is our hip flexors become too short, right? Because we sit so much. And so when muscles become short, they usually become overactive. So if you spend so much time here, these muscles their resting length is a little bit shorter than it should be. They're overactive, which if your hip flexors are overactive, that means your hip extensors are underactive and they're long. The primary hip extensor is your gluteus maximus. Your gluteus maximus is an incredibly important muscle. If you think about hip extension, how important is hip extension for being a human being? Like you try to stand up without extending your hips, try to walk, right? The gluteus maximus is extremely important. Hip extension is extremely important. We could flip it around and say, how about going downstairs? Although that's hip flexion, it's the eccentric contraction of the gluteus maximus to keep you from falling, right? So the overactive hip flexors inhibit your ability to extend your hip or to eccentrically decelerate hip flexion. And so your brain can't let that happen. And so it starts setting up different pathways and starts redirecting neural drive to your hamstrings and to your erector spinae. So the hamstring is also a unique muscle because as these muscles become too short, they pull your pelvis this way into an anterior tilt, pulls your hamstrings long, but because your glutes are inhibited, your hamstrings have to become overactive. So you have long but overactive hamstrings. People stretch their hamstrings all the time, but they're already too long, right? But it feels good because they're overactive. So you're trying to get some relief there, and it provides you with some short-term relief. But the best way to get your hamstrings to tone down is to get your glutes active. Okay, but we'll show you all the inhibitory stuff first for the pelvis. I'll show you both with the foam roller and with the ball. So, without getting too complicated here, I'll just start talking. If it gets confusing, stop. Don't let me go off on a tangent that is now not interesting or relevant to you. But remember how your latissimus dorsi attached to your pelvis, right? And if your latissimus dorsi becomes short, it pulls you this way. So they're contributing to this anterior pelvic tilt. So the first thing I would do if I'm dealing with somebody with an anterior pelvic tilt or with low back pain is inhibit the latissimus dorsi, right? And so that's again this right here, right? So just under the armpit, 30 seconds on each side, okay? Now, because of biomechanical reasons, another muscle that becomes overactive is your piriformis. Have you guys, anybody heard of the piriformis? Yeah. Piriformis is a painful guy. Small muscle from your sacrum to your hip, okay? So just this band, just where your back pocket is. And so you would inhibit it by getting on a foam roller, crossing over, and yeah. But you see, I don't feel it at all, right? I used to, when I would get on this, I'd be like, you can't even do it. Like, it's only been 12 seconds, right? I'd like tense. Once you do this for a while, it goes away, okay?
What kind of pain is associated with that?
We'll try.
No, I meant like,
Oh.
if you have an issue with that, like you don't want to start doing something like this. The trouble that I have, and it's unfortunate, is that car accidents aside, is that sometimes I'll get both hip sockets, and I fell here. I slipped on a piece of cardboard, and I wasn't ready for it. I went out, and I landed right on my lower back.
Mm.
And so I've never had pain in my left and my right, but now I've got it in both. And it's like something is, like you said, with all this shortening. And so when you try to do something, sometimes it's so painful.
Yeah.
But I've noticed that if I keep moving, that I'm all right. That's the old game, is to keep going, that I'm all right. It's later at night and in the morning that I feel it.
Do you have any pain down your legs?
Left leg.
How far down?
Right down to the ankle.
Okay.
But it's not
back?
pain. It's a dull sort of
They're down here?
Yes.
So you've been told you have sciatica?
No.
Okay, well, you probably do. Yeah, so,
I suspect that's what it is.
yeah, so sciatica means that we're bothering the sciatic nerve, right? Could be from the piriformis. The sciatic nerve goes right underneath, or in some people, right through the piriformis.
Right.
And so if the piriformis becomes overactive, it can pinch down on the sciatic nerve.
Right.
If you fell right down on your spine, you could also have a facet joint issue, some inflammation around your disc. Does it hurt if you lean forward?
Sometimes.
Sometimes. Usually,
Feels tight.
feels really tight. Yeah.
I mean, it's sort of a vicious cycle. If you
If you lean forward, but if you push your chair back and lean forward a bit, will that hurt your back?
Well, down here,
Okay.
there, the old area.
Yeah. So when diagnosing, the first thing when you're dealing with an injury is you got to find the pain mechanism, right? And so if somebody comes in, low back pain can be very sophisticated, or very complicated, I should say sophisticated, very complicated. And so the first thing you want to do is identify the offending postures and loads. So if it hurts to lean forward, that would mean that your pain mechanism is a flexed spine posture. And so you'd want to take that posture out of your life as much as possible. So you want to get a lumbar support for your back. When you tie your shoes, I mean, I've seen people, it's because nobody's told them, right? When they lean forward, it's like, oh yeah, that's it right there, and I get a pain down my leg. They're like, okay, well, can you get your shoes off? And then they just, right into their pain mechanism. Chronic low back pain is usually a repeated series of acute injuries. So you're just always doing something. It's like a little hammer. You keep hitting your thumb with it because nobody's shown you what the offending posture was, right? So it's probably a flexed spine posture. I would take a look at your seat in your car. Does it have a lumbar support when you sit at home? Are you sitting with good posture, or are you letting that spine flatten out? As you flatten that spine out, your disc, it's called discogenic creep. Your discs start to move out the back, and it starts to push on that nerve.
Right.
So that's why it comes and goes.
Yeah.
But the important thing is, if you have good days and bad days, that means you're totally capable of having only good days. Because whatever you did on the good days, just do that every day.
I never really had that well. So
Yeah.
I think that's why it's committed.
Yeah. Well, then that brings us,
You become defensive about it, so you do it.
and that brings us back to our conversation about capacity. If you've fallen on your back and you have postural issues and you have a job that's demanding on your low back, that means you don't have very much capacity saved up in those tissues. And so it could be a little walk or a little work around the yard. You spent all your money, and when you run out of money, that's what pain is.
That's exactly what.
So, but if you go for a little walk, maybe that's good, or you do certain things. Nutrition can even put capacity and take capacity as well, right? So start to look for patterns. This stuff would be, like, the one thing I'd be careful about is if you're going to release your piriformis. If you get pain down your legs, just for anybody, when you release your piriformis, that means you've upset that sciatic nerve and you want to move. Like, you know, you're not going to do any damage to it, but it's not comfortable. It doesn't feel very good. I've never heard of anybody doing any damage to any structures by foam rolling. Even when I said don't do your lumbar spine, never read anything or anything, but I would just say stay away from your lumbar spine. So what you could do instead of crossing this over, this is more aggressive, is you could start just with this, right? But again, if it's causing any issues, and you'd also want to be looking at your posture, this is not where you want to be starting to fall into that flex spine posture, right? So it's same thing, you do both sides, 30 seconds, okay? Then there's a muscle called your tensor fasciae lata. So your gluteus maximus in the back and tensor fasciae lata in the front tie into your IT band. You guys heard of the IT band? Yeah. IT band goes down your leg. You get IT band issues down here. You get pain here. Your IT band's like your Achilles tendon. Okay? So its job is to store and recover elastic energy. When you walk, I lengthen my IT band here. I contract my tensor fasciae lata. Boom. Right? Same thing going this way. Boom. It makes it a lot easier to walk. That's what it's for. But the tensor fasciae lata tends to become overactive, the glute underactive. And by the way, overactive muscles are weak. People think that short and overactive muscles are strong. They're 1/3 stronger than the long and underactive counterparts, but they're still weak. Okay? So we want to inhibit the TFL. It's right where your front pocket is, and you would just sit here like this. And this one is, I feel this, not today, but when my back gets really sore, this is the one that I'll feel, usually on the other side. But so you just sink right into your front pocket. Okay, so 30 seconds, 2 minutes, and then you get to go down your leg here. Now, people think this is your IT band. Your IT band's it's like a tendon. You can't release a tendon. But underneath your IT band is your vastus lateralis, which is one of your quadricep muscles. It has a tendency to hypertrophy, and if we're talking about complex things here, as you lose your ability to extend your hip because your glute's inhibited, if I increase my ability to extend my knee, what's that? That's relative hip extension, right? So the brain sends more impulses to your quads. They hypertrophy, vastus lateralis pushes out against your IT band, sticks to it, and you lose your economy of movement. So you want to inhibit your vastus lateralis. That's why people, they think they're inhibiting their IT band. It makes it feel better. It's just that they're freeing it up. So we go lats, piriformis, TFL, vastus lateralis, and then rectus femoris, which is on the front here. And you just survey, you just find the spot that is most tender. You could bend your knees as well and lengthen that muscle as you're doing it. That can be quite sensitive. So your rectus femoris is the only quadricep muscle that crosses your hips, so it's part of your hip flexor complex. There's 9 muscles that comprise your hip flexor. So they all pull you this way, combined with this tight lat, pulls you that way, and then you get the glutes, hamstrings overactive, piriformis overactive, but also long. Don't stretch your piriformis. Most people, it's already too long. Piriformis, again, it's more complicated than I was going to get to, but piriformis, hamstrings, and adductor magnus are referred to as the trifecta of terror because they cause so much pain. So your hamstrings, there's 3 hamstrings, okay? That's why it's hamstrings, there's 3 of them. Biceps femoris is lateral, and then you have semitendinosus and semimembranosus that are medial. The 2 semis are underactive, biceps femoris is overactive, okay? So, it's getting kind of complicated, but this is probably my favorite release technique. You get the ball under your biceps femoris. It can be anywhere along here. And if you have low back pain, if your hamstrings are tight and you feel like you need to stretch your hamstrings, you get a baseball or something, and sometimes you have to like hold it and kind of dig and find the spot. People don't find it immediately sometimes, but when you find that spot, you can apply a little overpressure. Man, you feel better immediately. Like it really makes a huge difference because it will help redirect neural drive to your glutes as well.
And the small ball will do the same thing.
Small ball will be a little harder.
This one.
I'll try it. I've never actually used it on myself. Oh yeah, no, that works too. Yeah, that works really well. And pressure is force over area, right? So if the area goes down, the pressure goes up. So that's going to provide more pressure, a little less and little less.
Sorry, but I said you just have to step back. Can you touch briefly on nutrition?
Yeah. So nutrition is a very personal thing. And it's not something I normally talk a lot about unless people ask. But and there's a lot of misinformation out there. It's really tough to get good information. The reason for that is 2 main reasons. One is who's paying for the study that came up with the result.
Yeah.
Right? That's the biggest issue. And they're supposed to disclose all that information. Rarely do they, right? If you do a little digging, which because I'm a researcher, I have to, you find out that they've left a lot of that disclosure out. Also, you have to take a look at the methods. And that's why it's so confusing, is because unless you're somebody that reads a lot of scientific studies and you know what would make up a good study, it's hard for you to determine whether you should believe this conclusion or not, right? That being said, it's important to understand that everything you eat is either contributing to your health or contributing to your sickness. There's nothing in the middle, okay? There'll be varying degrees of each. And that doesn't mean you never eat something that contributes to, because usually they're delicious, right? That there's mental health involved with that as well. It doesn't like this is also a very sad, depressing way to live, right? And so that's why it's such a personal thing. The things that I recommend to people, and I don't like to get too specific unless they're coming to me. If they're an athlete, of course, then that's different. That's their livelihood. But for the general population, there's a way of thinking of, there's an 80-20 rule. Have you guys heard of that?
Yeah.
Where 80% of the time you eat healthy and then 20%. I think that's a pretty good way to do it.
Yeah.
The one problem with that is sometimes people think they're doing 80-20, but they're actually doing 80-20 the other way. Right? But that's a good way to do it. Do you have any specific questions? It's such a big area to jump into. The things that are really important are getting lots of leafy greens. If we're talking about, say, brain health, like cognitive function, I think is the most important thing, and that's what I usually, I guess, prescribe certain nutrition plans for is cognitive function. The 10 most beneficial foods, if we were to do that for cognitive function, would probably be olive oil. Like, it has to be extra virgin. Avocados, blueberries, leafy greens, broccoli, and then you're getting into stuff that's a little more controversial, a little bit more complex, but dark chocolate is really great. Like, there's a lot of good benefits from dark chocolate. Coconut oil is really good. They've done a lot of studies recently with Alzheimer's disease and what coconut oil can do to Alzheimer's disease. And some people, it like stops it in its tracks. Broccoli sprouts, I find really good. And then we can get into the conversation about whether, meat is good or bad. The thing with food, and one of the issues why it's so confusing, is there's very few foods that are just bad, right? And very few foods that are just good. There's usually a big mixture, and it depends on the person and their lifestyle and other things they're doing, whether or not a food is generally going to be good or generally going to be bad, right? Some people have issues with lectins. I don't know if you guys heard of lectins. I have issues with lectins. So lectins are a protein, a plant protein, that in theory, it seems to have a lot of momentum. It's the plant's defense mechanism. And so plants don't want to get eaten either. They can't get up and run away. And so the best thing they can do is evolve to make the thing that eats them sick or die. That's what kills people who eat peanuts is the lectin, right? It's a very potent lectin. And so the lectins get into your body, you eat them, and your immune system recognizes it, creates an antibody for it, but that lectin has been designed to look almost identical to some of the structures of your body. So your immune system has like a coded mechanism. Every cell your immune system passes goes self, 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 self. Not self, analyze, destroy, or attack, whatever, right? The lectins make your immune system on heightened alert, looking for lectins, but they mimic your structure. They just mimic your cells, and so your immune system starts attacking itself because it's on high alert for these lectins. Some people, it's a huge problem. We're talking about, say, like rheumatoid arthritis, a lot of digestive issues, heart issues even. So I've noticed with myself, I've reduced my lectins, and that's made a big impact. The problem when you do that is you're taking out some vegetables, right? And then it's like, well, vegetables are good for you, right? Most people have no issues at all with lectins, and so all vegetables are probably good for a lot of people. Some of the vegetables, not so much, right? The biggest thing that I think the most harmful thing is sugar. And that includes, your body doesn't know the difference between fruit and candy, right? Fruit is really good for you. There's a lot of really good stuff in there, but it's high in sugar, right? So you want to limit the amount of fruit. Another thing with fruit is it has fructose, okay? Fructose is a calorie, but you can't use it for fuel. It goes straight into storage. So normally when you eat something, you can use it for fuel. Fructose goes straight to storage. And so the reason that fructose is around, and that's why animals that hibernate eat a lot of berries, is because it's storage. So that when they hibernate, their body can pull on it and take it and process it and turn it into fuel. But if we're eating high fructose corn syrup, we're just putting that into storage, waiting for, starvation, which is never going to happen for us because we have Safeway. And so we're just storing fat with no chance of burning it off, unless you go into a calorie deficit. So I'd stay away from fructose, stay away from sugar as much as possible. Any questions specifically about anything with nutrition?
Except for blueberries.
Blueberries are the best.
I eat them every day.
So do I.
I follow the Gundry.
Oh yeah, Gundry, yeah.
Yeah.
He's done a lot of work toward that stuff. Yeah, and that's one of the things too that I think it was him that started asking the question. So if a country goes to war, they have to bring a bunch of supplies for the soldiers, right? And so if you're in a constant state of inflammation because of the food you eat, your immune system needs supplies, and so it stores fat. And so you could be trying to eat all the right things and trying to lose weight, and you're like, how come I'm not losing weight? If you're inflamed, your body's not going to give up that fat. It needs it for the war. So one of the best ways to lose weight or to lose fat is to decrease inflammation, omega-3s, olive oil, your microbiome, your gut bacteria, probiotics really important, fiber, all of that. The microbiome has a huge impact on even your mental capacity, on depression, on all sorts of things like hormones, everything. So I would take a probiotics. One of the few things that I recommend as a supplement, probiotic.
Well, I don't want to cut you short. I don't want to get in trouble also with our managers, so.
Okay, yes.
Thank you very much.
You're
Thank you,
welcome.
that was great.
So, are you able to send out a mass email with my card?
Yes,
Or
yes,
with,
yes.
yeah, okay, so I'll give you my, or you have my email.
Okay.
If you want these routines, just send me an email and I just send them to you. Yeah.
And how does it, say we want to come to you for consultation or whatever, email you as well?
Yeah, I can do that as well, yeah. So what I do is I do movement assessments and I watch the person move, and from their movement I can tell where their imbalances are, and I can give a specific, very customized routine. They're very similar. Most people have the same dysfunctions.
I have to ask you, but it's not eligible for extended insurance.
For some, I don't know what I said for you, but for some, yeah.
We do have some coverage, yeah, through the extended benefit. I mean, I'm not sure the specifics, but I know I've definitely gone for physio, sports physio.
Yeah, it usually depends on however it's set up, because there may be like a bunch of different.
You are a licensed physiotherapist.
I'm not a physiotherapist.
Oh, okay.
Okay,
Yeah.
okay.
So that's my mistake.
No worries, but you're.
Yeah, clearly, I've learned some things that I can see the benefit immediately.
Yeah.
So thank you very much.
Oh, you're very welcome. Yeah. All right.
Obviously, the knowledge should be.
Yeah, if you got any questions at all, and like I said, I'm not here to make money off you guys. This is my home. I spent so much time in here, so anything I can do to help you guys out, it's free.
Thank you.
Yeah. Thank you.